loves football, American football.
Well, the research we're doing involves putting subjects in full American football uniforms and immersing them in cold water, and we're testing whether or not it's necessary to remove football gear in the event that someone has a heat stroke. Can we cool people effectively if they're wearing every single piece of football gear on and they're near heat stroke? And it turns out that when you put somebody with a full football uniform on in cold water is so powerful as a cooling agent that it doesn't matter if they've got the helmet on, pads on, pants on, they will cool tremendously fast even with all of that stuff on. And so right now we're revising the NATA's position statement on what to do with football players if they have a heat stroke. It's not necessary to remove all of their equipment before immersing them in cold water, so the clinician can save tremendous amounts of time by not having to do that. Once they reach the critical temperature of 103.1, we either have them step off the treadmill and then we measure how much time it takes for them to remove their pads, and then they once they're down to just their shorts, they enter the cold tub, and then on day 2 they come in, and once they reach the 103.1 temperature, we have them step off the treadmill, and then we have them wait next to the tub for the amount of time it took for them to remove their pads last time. And then they enter the tub with all of their gear on.
Heat stroke deaths are on the rise. We've lost more people to exertional heat stroke in the last 30 years than we have in the combined 100 years beforehand. And so the trend is getting worse, not better, despite we have more research on heat stroke now than we ever have before in history. And so there's a problem that we still need to address.